Now, for more on the aid situation, I'm joined by Mahmuda Khan, who is Executive Director of the Humanitarian International, a humanitarian aid charity. Now, thank you so much for joining us this evening, Mahmuda. Talk to us a little bit about the situation on the ground. For those who don't know, what is it right now?
Thank you so much, Eden. It's really great to be here. And my name is Mahmuda Khan. I'm the Executive Director of Humanitarian International, which is Canada's oldest Muslim charity organization. HCI has been in Palestine for over 20 years, and we have done numerous millions of investment in education, livelihood, medical aids, emergency, building homes. And it is beyond catastrophe what's happening right now inside Gaza. As you know, 6,000 airstrikes with 6,500 lives lost, amongst which 2,000 is children and 1,200 women. We also know that 15,000 people has been injured and that are in dire need for urgent medical care. There is really nowhere safe from the airstrike in Gaza right now. As a humanitarian worker, we haven't slept for days. It is very, concerning, and is becoming more and more concerning as we're getting more updates from our partners, our field workers on the ground, that even the humanitarian workers are not safe. Our field workers have gone missing. We haven't been able to trace them. We don't know if they're alive or not. Our warehouses where we have procured items for winter relief, food relief has been bombed, and we lost a lot of our supplies. We know other charities have lost their water facilities, homes that we have built, hospital, ambulances, schools, 206 schools, 29 hospitals has been bombed. So it is extremely dire, more than dire what's happening, and it requires immediate ceasefire in order for humanitarian organization like us. We're ready to get in there and provide aid, but we need the push from our government to allow us to do that.
Well, that really does bring us to the big question here. There are a lot of trucks at the border. Many humanitarian organizations, including yourself, say there's two big factors here stopping that from happening. First, the danger for humanitarians like yourselves on the ground there. And secondly, fuel. So walk us through those two barriers right now and just how much they're putting a hamper on providing relief.
Absolutely. So as you know, it is very limited and very controlled what is being allowed through the Rafah border right now. 20 trucks a day. And just to put it in perspective, before this crisis, on average, 100+ trucks used to enter through the border for emergency aids and whatnot. So 20 trucks a day really is a drop in the ocean. We also heard that it's only taking care of 4% of the daily needs. 4% is nothing. And it's allowing right now food, water, medicines. That's great. But what about fuel? Like I said earlier, the doctors and the hospitals have said that they had to stop emergency surgeries and emergency life-saving treatments because there's no fuel. So I go again to share some numbers with you. We know right now, as of right now, there's 2,000 cancer patients, 1,000 individuals who relies on dialysis, 130 premature infants, pregnant women. They have no aids that they need because no fuel is available. So it is very urgent. And it is extremely important that we open the corridor. We have more charities go in there with more aid, and fuel should be included along with food, water, and medicines.
Mahmuda, I want to talk a little bit more about the safety aspect of this. Some politicians, world leaders are calling for a temporary pause in the fighting, but other organizations are saying that's not enough. We need a complete ceasefire. Can you walk us through the difference between those two things and why one is better than the other for humanitarian relief?
Absolutely. I mean, firstly, Canada has taken far too long to call for a humanitarian pause, and it's a good first step, but we definitely need to push for a permanent ceasefire. I mean, how long is this pause going to be? How much aid is going to go in there? We need to make sure that no single life is lost from here onward. Enough lives has been lost already, and these are innocent children, women, senior, sick people. A human life is a human life, and these are not numbers and stats we're sharing. These are the stories of lives that we have, built a connection with over decades, that we have provided them aid. So it's a first step, but for a permanent solution, we need permanent ceasefire. It requires years, I'm talking about decades of work from humanitarian work that's been destroyed, like the hospitals, the water wells, the homes. We need time to rebuild and restore everything. So humanitarian pause is not the answer. We need a ceasefire.
Mahmuda, really quickly before I let you go here, can you let our viewers know where they can donate if they do want to help?
Absolutely. Please visit us at humanconcern.org and please donate. We are providing, because we have had some internal items procured, we have multiple warehouse where these items were stored. So we're still able to get aids out, but we are running low of supply. So we need the ceasefire. We need the humanitarian corridor open to make sure that we're able to procure and get more aids in. So follow us at humanconcern.org and you could donate there. And, Canada is being so generous. We, as a medium-sized organization, we have raised over 8 million just in 12 days. And there's so many other charities that have raised millions, and we're ready. So we just need this ceasefire and humanitarian corridor open. We're ready to help, and we need to get out there and save these lives.
Okay, Mahmuda Khan, Executive Director of Human Concern International, thank you for joining us today and for all the good work that you do.
Thank you so much. Thank you again.